Hi, I'm Dr. Michael Augenbraun, Director of the Infectious Diseases section here at SUNY Downstate Health Sciences University. August is National Immunization Awareness Month. This is an annual observance held every August to highlight the importance of routine vaccination for people of all ages. The two most important measures, inarguably, ever developed to reduce the consequences of infectious disease have been the improvements in sanitation and the development and wide-scale administration of immunizations, primarily through the use of vaccines. Through the use of vaccines, we induce the body's own immune system to recognize and protect us from infectious agents that might otherwise cause severe harm. Without priming the system in this way, the immune system might not be able to respond rapidly enough to provide adequate protection. And as it is often said, an ounce of prevention is worth a pound of cure. Better to be vaccinated than to have to get sick and rely on antibiotics, assuming such an antibiotic even exists. Now, the use of safe vaccine products dates back about 250 years, when an English physician named Edward Jenner first demonstrated the effectiveness of using injections of mild cowpox virus to prevent smallpox. Smallpox had for many millennia been a terrible disease, causing much death and illness across the globe. Today, through the wide-scale use of vaccines, smallpox has been essentially eliminated. And it isn't just smallpox that has been effectively removed or reduced as a frightful worry. Many terrible diseases well known to our ancestors have been rendered items of mostly historical interest. Think of diphtheria, measles, polio, rabies. In addition, vaccines have now made other diseases such as hepatitis A and B, pneumococcal pneumonia, meningococcal meningitis, Haemophilus influenza, chickenpox, and shingles much less common than they used to be. Human papillomavirus, which causes cervical cancer, can now be prevented with a vaccine, a striking development. And of course, vaccines for COVID were instrumental in blunting the effect of this deadly pandemic. The list goes on and on. Now, based on current technological and scientific procedures, vaccines undergo rigorous development and testing before they can be approved by the FDA, the Food and Drug Administration. Ordinarily, they contain several essential elements. First is the antigen. That's the component of the infectious germ or toxin the immune system needs to recognize. Then there's the adjuvant. This is sort of a booster to stimulate the immune system to respond. And there are stabilizers and preservatives to safely maintain the product. Vaccines must go through an escalating series of trials demonstrating both efficacy and safety before the FDA approves the product for licensure. Then, the CDC, through the use of an independent panel known as the ACIP, or Advisory Committee on Immunization Practices, decides on whether and how to recommend the vaccine for use in the United States. Furthermore, there is an extensive system in place to monitor for adverse effects once the vaccines are being used in the community, a process not ordinarily seen for other medical interventions such as medications and devices. Another important aspect of vaccine effectiveness that differs from other sorts of medical interventions that sometimes gets overlooked involves the need to ensure adequate vaccine coverage in our community in order to achieve adequate control of disease. If, for example, I have high blood pressure, the health of my neighbor is not dependent on whether I do or do not take my medication. On the other hand, since no medical intervention is 100% effective, the risk to my neighbor of an otherwise vaccine-preventable infectious disease may very well depend on whether I have been vaccinated or not. Community, not just individual use of a vaccine, matters. This is especially true for members of our community who, for one reason or another, such as receipt of cancer chemotherapy, diabetes, kidney failure, or HIV, because of a weakened immune system to begin with, cannot rely on vaccines and instead rely on us, their family, friends, and neighbors, to do everything we can, including vaccine receipt, to prevent diseases from getting a toehold in our community. Now, many people have voiced concern about the safety of vaccines. Concerns about healthcare interventions are always warranted. I've already discussed why vaccines in the U.S. are rigorously tested and remarkably safe. Side effects, of course, do happen. There may be pain or redness at injection sites. Some people develop a low-grade fever after vaccines, and very rarely more serious reactions like allergies can occur. But serious adverse consequences are infrequent, probably less frequent than the chances of an auto accident or tripping on an icy sidewalk in winter. And contrary to rumors not based on sound evidence, vaccines do not cause autism and they do not impair fertility. They prevent disease and they save lives.